Well, it's an interesting question because when we think about the sort of shared utilities that have an infection control risk component to it, I think about food, I think about water, and I think about air. And those utilities, especially water and air, are used across the entire continuum of care in that patient's delivery of their services of care, right? So think about a patient that comes in for a procedure in the perioperative setting. They're going to start with the check-in process. They're going to go to pre-op. They're going to certainly get prepped for their procedure. They're going to go into the OR, and then they're going to finish their stay in the PACU and recovery unit. And so the air, right, follows them. The risk of the air may be different, certainly in the operating room, than they may actually be in the PACU, right? We would expect that there's going to be different, for example, chemical, biological exposures in the OR than there certainly should be in either the pre-op or the PACU setting. And so the reason I'm sort of framing it in that context is that the air is a shared sort of risk. And as such, the standard of care should be the same regardless of where the patient is actually receiving the care. The same is true for healthcare providers, right? So if I have a pre-op nurse, actual OR circulator in the actual operating room, or a PACU nurse, right, in the recovery area, they also expect their air to be safe, right? And so I would, really recommend using autonomous, continuous air solutions, right, that are decontaminating the air in each of those areas. And that's really going to not only reduce the risk for surgical site infections, but also make sure that we're keeping the air as clean and sanitary as possible. Again, going back to our lovely pandemic that we experienced, if we learn nothing from that, providing for safe workplace environments, the air is a critical component of that journey, right? And our healthcare workers want to know that when they're delivering care, that the air around them is also safe for them to be in the midst of as well.